So the trends in infections and deaths that are caused by the Omicron variant have raised hopes that COVID-19 is starting to shift from being a pandemic to a more manageable illness, like the seasonal flu, for instance. However, WHO Director-General Dr Tedros Ghebreyesus is warning countries against assuming that Omicron will be the last variant signaling the end of the COVID-19 pandemic. In fact, he says new mutations can still emerge and is calling for discipline and unity in combating the virus. Well, Director of the Center for Epidemic Response for Innovation, that's Professor Tulio de Oliviera, is our guest on that issue this morning. And Prof, it's great to see you. Thanks very much indeed for making time. I mean, as a start, what is it exactly, do you reckon, about Omicron that's even led to discussions about it signaling the end of the pandemic?
Yeah. Good morning, Ayanda, and good morning to your viewers. Yeah. So there is three main reasons why Omicron is much less what we'd call deadly. What it means, it causes less hospitalization and deaths. Yeah. The first and most important, it is that the vaccination rate around the world, which hold very well. Yeah. And so what it means that Omicron has great facility to break through vaccines for causing infection, but the vaccines protected very well against development of disease and hospitalization. The second, it is also confounded by high level of population immunity, most from vaccination, but also through previous infection. With previous infection followed vaccination generates very high antibody levels. Yeah. The second cause, it is because the Omicron tend to cause infection at high level at the upper respiratory tract and less at down in the lungs. Yeah. So itself, it causes a little bit less disease, but the bulk of the less disease development is through the vaccines. Yeah. And the third, it is that we learn a lot during this pandemic, especially the clinical staff. We have antivirals. We know how better to track the numbers. So, for example, in South Africa, as we discovered the Omicron variant, we stopped like really freaking out about number of infections, but looking at number of hospitalization and hospital capacity. And the clinicians also know much better how to provide oxygen and intubation. So in general, what it's happened is that all the pharmaceutical interventions and the clinical response really improve. And then with high level of vaccinations, we cause much less number of deaths. And that's why I would also stress what Dr. Tedros is saying. That's very important that we do not leave many countries behind on vaccinations, so we can offer this protection to the whole world.
Yeah, and given the fact that there are still so many countries, at least on our continent, that aren't necessarily at the levels of vaccinations that are ideal, does it make sense for us to start speaking about dropping these non-pharmaceutical interventions? Because I'm sure you'll agree, the conversation as it's unfolding in Europe, in countries like the UK, is very different to the kind of conversations we can have in Africa because of just the different rates of vaccinations as a start.
Okay, just for a start, it's South African basic leading the world on reducing restrictions and looking at the right data and also increase vaccination. So South Africa was the first country that, as detected a fourth wave, did not increase the non-pharmaceutical restrictions. On the opposite, one day before our new year, our government scraped one of the last big restrictions that was that people couldn't go out between midnight and 4 in the morning. So we are learning a lot from South Africa on that. Of course, that a lot of the more radical non-pharmaceutical interventions, such as lockdowns, they are really damaging to the economy and also damage to mental health and society in general. So that's why we are changing to only use that kind of interventions when everything failed, which was not the case in South Africa and at the moment in most of the world. And of course, most of people want to go back to normal life, and that's why we're seeing dropping on the non-pharmaceutical intervention, especially about social distance, number of people that can gather. And one thing that we know is that mask is still in closed spaces is still very, very effective, and that's the one that we're going to have to balance quite well in South Africa in the next few months.
Part of the suggestion made by a couple of health experts who've written an open piece, a letter essentially calling for the end of the state of national disaster, is saying that we should actually be able to go on with life without wearing masks, but wait for early signals before we can start putting the masks back on. And I guess the question to you then, Prof, becomes, does South Africa have the capability to pick up these signals early enough to send out a message that masks need to be worn in order to avert a worst-case scenario?
Yes, the answer is yes. South Africa has what is considered around the world one of the most developed early signal system, and that's involved both wastewater testing, also involving our NHLS and the private laboratories to report data into the NICD database. And we also have a very, very advanced genomic surveillance, which allow to detect variants in the beginning. So South Africa detected very early. The two earliest variants that have been detected in the world, the Beta and the Omicron, were done in South Africa. So the answer is yes, South Africa is very well prepared for really tracking this pandemic and seeing unusual number of infections and evolution of the virus.
So with that in mind, it would be possible for the country perhaps not to have an expectation for the wearing of masks at all times, but to have a situation, a system, if you like, to balance when the masks will be on and when they can be relaxed.
Yes, at the moment in the country, people don't wear masks all the time, and it's mostly restricted to kind of almost an etiquette to go to a shopping environment or get in a busy transport. As you notice, you are not needed to wear a mask outside when walking or exercising or when you meet with family and friends or in a restaurant. So South Africa already do not have a very strict use of masks. I think that's still quite important, in closed environments, and that's why it's very important to also have airflow, So, for example, in our labs and in our offices, the first thing that we do when we arrive in the morning is to open every window, to get some airflow. That's a very simple and very effective intervention, and try to avoid what would be putting people in risk, especially people that are unvaccinated or have comorbidities.
Yeah. What has also been very interesting about the Omicron variant, if I can go back there, Prof, is this phenomenon that clinicians like yourself have mentioned, the decoupling of hospitalizations and infections. Essentially, the virus will still spread, at least if Omicron is anything to go by, but not as many people will die from contracting it. I mean, does that, I guess, give us an idea of the mutations that are on the way, or is COVID still way too unpredictable to make that call?
Okay, so one of the things that help a lot South Africa, and that's why we could look very clear at the hospitalization deaths, is that when Omicron emerged, we had very small number of infections. And many of your viewers will remember around November last year, we had a few hundred infections a day. So what it means, we had spare hospital capacity. So the extra hospitalization could be managed very well. Unfortunately, this didn't happen in many places in the United States of America, because when Omicron emerged, they're still in the middle of a very large Delta wave. So, for example, in South Africa, we started the discussion of not using masks, and in the US they went to enforce the use of N95 masks. So that's the mask that's used, for example, by healthcare workers. So it's all depend also on the phase of the pandemic that you are, and the number of extra beds and spare capacity. And that's the kind of data that both our team, but many of the experts in South Africa and the Department of Health are looking to make decisions.
Sure. All very fascinating. Professor Tulio de Oliviera, thanks very much indeed, as always, for speaking to us and helping us understand these different phases of the pandemic. Really do appreciate your time. The good Prof is the Director at the Center for Epidemic Response and Innovation. Once again, thanks very much indeed.